We will talk about Holmes disease today. Did you know riluzole is a medication you should ask your doctor about? The medical field needs to do more experiments with it, and it seems to bring some help to Holmes patients.
Can you give a brief definition of it?
Cerebello-olivary degeneration of Holmes, or Holmes for short, is a genetic disorder affecting the nervous system and damaging it. It actually covers a wide range of diseases, and it all depends upon which gene has a defect. These disorders result in the degeneration of the cerebellar cortex. The cerebellar cortex is the superficial gray matter of the cerebellum. It consists of two main layers, the stratum moleculaire and the stratum granulosum. There are two levels of impairments which are called OPCAs. OPCAs are a group of inherited and sporadic disorders which share progressive ataxia in combination with impairments of the cerebellum, the pons of the brain, and the olivary nuclei. Some of the clinical impairments may include muscle rigidity, which is a stiffness in muscles, nystagmus, which is an eye impairment, retinal degeneration, which is yet another eye impairment, dementia, which is a loss in memory, and urinary incontinence. There is the familial form of Holmes. It has an earlier onset, or in other words, a person can contract it earlier than in the sporadic form. The familial form may feature spinal cord atrophy or what is felt as a pain in the back, and the sporadic form tends to be present later on in a person's life.
This is what the doc told me. OPCAs are neurodegenerative syndrome characterized by impairments of the cerebellum and impairments in the spinal cord. Some of the impairments may include dysarthria, which is difficulty in articulating words, and dysphagia, which is difficulty in the act of swallowing. This explains why it may be easy for someone with dysphagia to easily gag.
Okay, now let's talk about some of the pathophysiology involved. Pathophysiology is the study of the changes of normal mechanical, physical, and biochemical functions, either caused by a disease or resulting from an abnormal syndrome. OPCAs have many specific genes that have been identified in their genetic forms, although how the genetics decline remains uncertain.
Do you know any stats and numbers?
OPCAs can be seen in 3 to 5 people per every 100,000 individuals, and about 5 to 6% of these observed people have been diagnosed with Parkinson's disease.
Cutting right to the point, there's no definitive treatment. Eventually, many patients become wheelchair-bound. Dysarthria, which is difficulty in articulating words, and severe dysphagia, which is the difficulty in swallowing, happen.
Anarthria is the inability to articulate remembered words and is not uncommon as the disease progresses. Ailments increase significantly, including falls and aspiration pneumonia, which is an inflammation of the lungs and often results in death. Most often, the clinical manifestations of OPCAs consist of what is called a slowly progressive pancerebellar syndrome that usually begins in the lower extremities and then progresses to the upper extremities. Usually, the initial sign in OPCA is a broad-based cerebellar ataxia gait, which is the way someone walks when drunk, and it is very possible, but less likely, to have what is called a Parkinsonian gait, which makes another person think you have Parkinson's disease.
Here are some definitions the doc told me to remember. Ataxia, which is the inability to voluntarily coordinate muscular movements. In a little tidbit thing to know is that doctors use what they call the on-heel-to-shin test. The most prevalent impairment relating to the spinal cord can be seen in what is called the extensor plantar response, which is an abnormal reflection that occurs with the foot.
Here are some of the things to do to help fight Holmes, but remember, there's no definitive cure. Anti-Purkin G-cell antibodies are helpful, vitamin E, fish oil, and omega-3 are helpful supplements. I have a question of curiosity for you. What type of test did you have done to diagnose you with Holmes and is used for OPCA patients?
And MRI is the imaging study of choice.
Consultations with physical and occupational therapists are helpful to increase mobility. The use of canes, crutches, walkers, and/or wheelchairs will increase a person's functional ability. A swallowing evaluation can be a very important part of the early consultation. Now that genetic testing is available, it can be performed to confirm a diagnosis and/or give an early diagnosis if symptoms are not yet prevalent. Family members must be evaluated early. Referral for genetic counseling is advisable in these individuals.
Thank you for your time, everyone.